No one knew because it had never been tested. So under normal circumstances, it would be reckless and crazy to try and push people to take something whose outcome you couldn't predict. But the CDC did it anyway. The CDC encouraged pregnant mothers to take the COVID shots, even though, once again, the initial vaccine trials excluded pregnant women and women who were lactating. The CDC tweeted in August, for example, that, quote, people who receive mRNA COVID-19 vaccines while breastfeeding have antibodies in breast milk that can help protect babies. Huh. Antibodies in breast milk. Well, it turns out that mRNA vaccines in breast milk might have some unforeseen effects on developing babies. The Journal of the American Medical Association Pediatrics has just revealed that the mRNA from the Moderna and Pfizer COVID-19 vaccines has showed up in the breast milk of lactating women, in some cases many hours after vaccination. According to the JAMA letter, the effects on children are completely unknown, as they would be. And that's scary. Quote, caution is warranted about breastfeeding children younger than 6 months in the first 48 hours after maternal vaccination until more safety studies are concluded. Oh, thanks for telling us now. It concludes this way, quote, the potential interference of COVID-19 vaccine mRNA with the immune response to multiple routine vaccines given to infants during their first 6 months of life. What does this all add up to? It sounds ominous. Dr. Marty Makary is a professor at Johns Hopkins who joins us tonight to try and straighten this out. Doctor, thanks a lot for coming on. I mean, I think everyone would agree you probably shouldn't recommend drugs to people if you don't know what their effects are going to be, but, you know, the horse has left the barn on that. What do you think this means going forward?
Well, look, when pregnant and lactating women had concerns and they had questions, the right answer was we don't know, not just take it and stop asking questions. The research is catching up now. First of all, the mRNA does not stay in the muscular area. It's injected intramuscular. This research confirms it does not stay in the place where it's injected. Now, normally there are biodistribution studies that evaluate where these nanoparticles are carried in lipid carriers throughout the body and in excretions as well. But those studies were limited. They were skipped. Many of the findings that were done in the limited studies were concerning. There was no follow-up. We know this from the FOIA documents. Many experts I talked to are concerned about interactions with other child vaccines. Kids get a lot of vaccines before they're 6 months of age. And when you give a vaccine to a woman who's pregnant, it causes general body inflammation. And that's well known to be deleterious in pregnancy. General body inflammation has risks in pregnancy. That's been well studied. If a woman has some inflammation from periodontal inflammation of their gums, then that is associated with preterm labor. Why do we think this inflammation has no downsides? If they're already immune, what are we doing anyway? And sometimes the women have lymphadenopathy, which means they can't engage in breastfeeding when they're trying to lactate. And I think what's interesting is the authors of this study spun it to say that the vaccine is safe among lactating women. They call them lactating individuals in the study. They studied 11 women, only looked for the mRNA 48 hours later, and then concluded that it's safe in women. You can't make that conclusion from this study. In my opinion, the editors told the authors of the paper, this is how you should conclude. I've had that experience with writing for the top medical journals. I've published hundreds of peer-reviewed articles out of Johns Hopkins, and the editors will often say, you need to write it this way, and then you're in a dilemma. Do you use the profile of the journal to publish the study, or do you retract it over a dispute because a couple editors have a lot of power and control?
The FBI seems to be showing up at the homes of a lot of different people recently. Will anyone ever be held accountable for this? I memean, it seems like some of these risks were known. You just said inflammation is a well-known risk for children in utero. Will anyone be held accountable?
Yeah, a lot of humility would have gone a long way in just being honest with people about what we don't know. And these are the lowest risk people on earth. They're women, they're in their 20s, 30s, teens. These are not people who are high risk where the vaccine has maybe some benefits that you could counter with the risks. That's not the case, it appears, in women who already had COVID and are low risk anyway.
Damn.